Hello everyone, myself Dr. Taposh Kumar Pal and welcome to my channel Physiomax Organization. Today we will discuss about a bone whose name is patella. The patella, what you are seeing over here, it is a type of sesamoid bone and it is also called as a largest sesamoid bone. The reason why it is called as a sesamoid bone is it develops from a tendon whose name is quadriceps tendon or the quadriceps femoris tendon, and that's why it is named as a sesamoid bone, and that is the bone which is dependent on the muscular activity, which direct does not have any function. That's what's the reason why it is called as a sesamoid bone. So today we will be reading about this particular bone and in a different aspects, like we will first read the anatomical position of the bone, number 1. Number 2, we will read about the side determination of the bone. Number 3, we will see the ossification of the bone. Number 4, we will see about the surface and the borders of the bone. Number 5, we will see the muscle attachment, and the number 6, we will see about the applied or the clinical anatomy of the patella. So everyone, come, let us see about the anatomy of this patella bone. So first we will discuss about the patella bone and at the anatomical position of the bone. As we are seeing over here, the anatomical position, to understand the anatomical position of the bone, first we have to understand which is the superior or the base and which was the inferior or the apex. As this is a triangular shaped bone, you can see the triangle over here. The superior one, this is what's called as a base, and the inferior one, this is what's called as a apex. Again, the superior one, this is the base and this is the apex. And if you see the anterior aspect of the bone, which is bit irregular, this is the anterior surface, and on the posterior aspect you can see there is a regularity of the plane surface. So by that we will understand which is the anterior one and which is the posterior one. And also on the posterior aspect, the lateral one, you can see a concavity surface, and on the towards the medial side you can see a convexity surface which is bit small, and the lateral one is bit large. So by this we understand the anatomical position of the bone. Now coming to understand about the side determination. To understand the side determination, first what you have to do, you just have to hold the bone and keep the bone in such a way so that the base should face to you and the apex should face out of you. Once more to repeat, you will just hold the bone, and so the base will face to you and the apex will face out of you. And the time you will keep the patella on the surface, and whichever surface the patella will lean down, that is that side bone. For this particular bone, we can see the patella leaned towards the left side, and that's the reason we can tell this is the left side bone. And this is how we can understand which side is the patella, and that's the side determination point of patella. Coming to the ossification, the patella, like other bones, it ossifies and starts its ossification within an age group of 3 to 4, and it ends up with the age of puberty, and that is what the ossification of the patella is. Now we will discuss about the surface and border. This patella is having a 2 surface and 3 border. The 2 surface is the anterior one, which is bit rough, the posterior one which is smooth and plain. So these are the 2 surface. If we talk about the border, we can see this is the lateral border, this is the medial border, and this is the superior border. So there is a three border. Once more to repeat, this is the lateral one, this is the medial one, and this is the superior one. These are the three borders of the patella. Next, coming to the muscle attachment of the patella, as I told already, the patella is dependent on the muscular contraction on all the four sides. Superiorly, the patella is attached with a muscle, the muscle tendon which get attached over there, that is the rectus femoris, and just below of that, just besides of that, there is a muscular attachment whose name is vastus intermedialis. On the lateral aspect, there is a attachment of vastus lateralis muscle, and also in the medial aspect there is a attachment of the vastus medialis. But the major muscle fiber which just attached with the patella is the vastus medialis obliquus, which is a continuing fiber of the vastus medialis muscle which attached over here, that is the vastus medialis obliquus muscle. On the inferior one, or from the apex, there is a continuing tendon that's named as a patellar tendon, and that is how all the four sides the patella is dependent. Once more to repeat, on the lateral side we are having the vastus lateralis, and also the superior fiber of the IT band, which is a continuing fiber of TFL, is attached over here. On this side we are having a VM, vastus medialis, and the vastus medialis obliquus. Superiorly we are having the rectus femoris, on that just besides of that we are having the vastus intermedialis, and inferiorly we are having the patellar tendon, and that is what's the muscle attachment of the patella. Coming to the clinical anatomy, there is a two important clinical anatomy of the patella, that is maltracking of the patella or lateral patellar maltracking. Sometimes this VMO, this vastus medialis obliquus muscle, is to get weak, or from this side the IT band might be tight, resulting the patella will just shift from its own position. As you know, the patella sits in between the intercondylar groove which is present just between the two femoral condyle, and it acts and it moves like a boat. But sometimes because of the weakness of this VMO or the tightness of the IT band, the patella will maltract, and this condition clinically we tell as lateral patellar maltracking or patellar maltracking or maltracking of patella. This is the first clinical anatomy, and the second clinical anatomy is whenever there is a maltracking of the patella, on the posterior aspect there is a articular cartilage which prevents the friction between the posterior aspect of the patella to the femoral condyle. There is a chance of having a wear and tear of this articular cartilage, resultant there is a arthritic changes which is called as a patellar arthritis or arthritic patella or patellofemoral arthritis, PFA. So these are the two conditions what we can see as a patellofemoral arthritis condition. So that's about the anatomy of patella. So those who are new for this channel, don't forget to subscribe the channel, and those who are in the channel, don't forget to like the video to learn all the different aspects of medical anatomy. Thank you everyone.